Hello, my name is Dina Shvetsov, and I'm a PhD student at the Politics Department of the New School for Social Research. And today I would like to share some thoughts on Russian state's response to the coronavirus crisis. So, the central problematic of the COVID-19 crisis all over the world emerged as the relationship between the state and its people. During the first months of the current health crisis in Russia, the nature of these relationships got exposed in ways previously unseen, reminding us that in the expected crisis moment, in the calculation of costs and benefits, those who endure the costs are not those who bear the benefits. The events of the last months demonstrated that many countries, including Russia, initially faced the choice to move to prevent a crisis or to prevent the knowledge about the upcoming crisis from spreading. Russian political leadership chose to pursue the discourse of reassurance before rapidly switching to the emergency measures laid by Moscow's lockdown on March 30th, among almost 3 months after the first case. By April 2nd, more than 1/3 of the administrative regions of Russia reported cases of coronavirus, raising the official statistics to 3,500 cases in the whole country. 1 week before the Moscow's lockdown, a senior official from the Ministry of Health, when denying that Russia is underreporting numbers, stated that all relevant medical institutions and agencies of Russia are ready, I quote, well coordinated and well prepared for the COVID-19 outbreak, end of quote. In her attempt to reassure the public, she evoked the welfare system of USSR, implying that the USSR built healthcare institutions and practices could be mobilized to fight coronavirus. Here it is helpful to remind you that these statements were made after the nationwide protests of the medical professionals against layoffs in late November, and also after the publication of data about the stark decline in the number of doctors and nurses in 53 regions of the country, with no first response medical personnel in about 500 townships all over Russia. Rarely other instances of reassurance, however, derive this legitimacy from the socialist principles. But an absolute majority of the initial official rhetoric assumed an anti-market, anti-liberal pretext, postponing taking real measures, except for ones implying the calculation of projected costs of the declining demand of Russian energy resources due to falling production in China. As such, beginning of early February, Russian President Putin made a number of statements about taking away licenses from the pharmacies that inflate prices on masks, while the Deputy Prime Minister Golikov, when talking about evacuating Russian citizens from the zones of the virus's outbreak, claimed, "We are not leaving our people behind." So after the state had to officially acknowledge the necessity of taking political and economically costly measures in early April, the conversation about responsibility acquired yet another new direction. This rhetoric and strategy was borrowed from a somewhat older repertoire. This new direction implied an important shift from reassurance and representation of the state as taking responsibility for protecting citizens towards the attitude of insistence of self-reliance, a critical move back to rhetoric of liberalism. In late April, when the curve of the new COVID-19 infections all over Russia started getting as steep as in Moscow, the representative of the Russian Ministry of Foreign Affairs in her interview related an opinion claiming that foreign travel became too accessible for Russian citizens, particularly those without connections and means. In the beginning of April, about 25,000 Russian citizens, most of whom were tourists, remained abroad. The official called such overseas traveling, I quote, risky and irresponsible, both personally and towards the Russian government, end of quote. The emphasis on social and economic privilege that emanated from her statements evoked public outrage and resonance. The same pervasive pattern, though, of reallocating responsibility and redistributing of risks assumed different forms and took place on different political and discursive levels during the outbreak of the virus in Russia. The redistribution of responsibility that we have seen, for example, by the president in early April, giving governors of the Russian administrative regions the rights to decide on the measures after months of suppressing the information about the cases, represents a method of redistribution of responsibility from top down, while the purpose of the potentially scapegoating, politically censuring, or even deposing the officials below the president. This is often done to reduce the government's political risks and boost the president's rating. The practice predates Putin's now 2 decades in power, but was arguably ritualized and refined during his multiple terms. As such, appointment of Sergei Kiriyenko, a relatively young and unknown political actor, to the office of Prime Minister weeks before Russian economic collapse in 1998, only to depose him exactly 4 months after, is in nature the same political move as giving regions sanctions to decide on their needs in combating coronavirus in 2020, when subsequently a week later publicly chastising the governors about their abuse of power. As Slavoj Žižek argues in his new book, Pandemic, COVID-19 Shakes the World, freedom of speech and trust between governments and their people proved to be critical for the prevention of the health crisis all over the world. Those two components, freedom of speech and trust, seem to be quite often lacking. The main question to be asked here is, why would some governments choose to prevent the spreading of the knowledge about the growing number of cases of COVID-19 infection and the resulting expanding of the scale of the problem, rather than moving to prevent the ongoing health crisis from taking hold over their nations? Yet, amid this rapidly developing situation, one of the central themes of the reaction of the Russian government to the ongoing pandemic was the redistribution of its own political risks. Michel Foucault, in his essay on Governmentality, wrote that the problematic of government at the time of political modernity revolves around the deployment of a, I quote, range of multiform tactics that constitute mechanisms of control of the population that are driven by the apparatus of the state. However, we now see that the rationality of the government that represses information about the spread of virus, in our case Russian state, proves to be somewhat different. Russian governmentality has not been about the relationship between the government and its people, whether it is based on the people's trust while sustaining the democracy and legitimacy inspired by Zizek, or the bureaucratic machine ordering the population for the sake of ensuring durability of the state, as in Foucault's. The rationality of the Russian government diverges from both, in so much as it seeks to ensure the right distribution of power among its different institutions and the ability of the president to quickly redistribute political responsibility among different executive and administrative levels. Thank you.